everyone, Cindy Santa Ana, Integrative Nutritionist for the Amen Clinics. I'm your Wellness Wednesday host. Last week I chatted about some symptoms and causes of chronic systemic inflammation. Today I'm going to share with you some tips to lower that inflammation. Chronic systemic inflammation is the type of inflammation that lingers in the body and damages our cells and tissues. It can play a huge role in numerous health conditions from cardiovascular disease to diabetes, cancer, and even memory problems. Luckily, there's some things you can do to put out the fire. The first is to get a handle on stress. One thing that causes inflammation is chronic stress. When we are stressed out, it activates our sympathetic nervous system, known as our fight or flight response. When it becomes activated, our body thinks that we are under attack. It revs up our system to produce cortisol and other inflammatory proteins. These chemicals are beneficial when we're under short-term stress, but they can cause problems if they linger in the body. Having a toolbox of stress-reducing techniques can bring down the stress response and bring calm to the body. Techniques such as breathing, mindfulness, meditation, and yoga have all been demonstrated to have a powerful effect on reducing mental stress and decreasing those inflammatory conditions. My go-to when I'm feeling stressed is deep breathing. This helps calm the body, helps lower heart rate, lower blood pressure, and helps to regulate cortisol levels and suppress inflammation. We're all faced with stress, but that's not going to change. But how we respond to stress is what's important, and how we handle it. So practice some of those deep breathing techniques. The next step is to move your body. Exercise helps decrease inflammation. A study published in the journal Brain Behavior and Immunity showed that just 20 minutes of daily exercise helps reduce inflammation. The exercise doesn't need to be intense. Even 20 minutes of some vigorous walking can help. And additionally, regular exercise helps reduce our fat mass. And fat, especially abdominal fat, produces inflammatory proteins that can contribute to systemic inflammation. The next step is to get some solid sleep. There's a lot of strong evidence that shows that a lack of sleep raises the level of inflammation in the body. In fact, there are many studies who show that people who sleep poorly or don't get enough sleep have higher levels of inflammation. So try your best to get 7 to 9 hours of sleep at night, and if you struggle with sleep, reach out to your practitioner to get some help. The next step is to improve your gut health. Improving your digestive function can help. Conditions like leaky gut dysbiosis have far-reaching effects through the body, from our brain to our bones. So if you have symptoms of gas, bloating, tooting, belching, indigestion, chronic constipation, brain fog, mood issues, joint and muscle aches and pain, let's chat. The last step is to follow an anti-inflammatory diet. So following an anti-inflammatory diet can help support in healing if inflammation already exists, or it can prevent it in the future. You should avoid heavily processed foods, packaged foods, and foods that have a lot of excess salt, sugar, and refined carbohydrates. You also want to avoid pro-inflammatory oils such as soybean, canola, sunflower, safflower, and cottonseed. All of these types of foods will fuel inflammation. What you should be eating is a diet rich in leafy green vegetables, cruciferous vegetables, onions, garlic, citrus fruits and berries, and lots of omega-3 fatty acids. So make sure you're eating wild-caught salmon or sardines or halibut, and you can also get omega-3 fatty acids from walnuts, chia seeds, and flax seeds. There are also great anti-inflammatory herbs to add to your diet. So turmeric and ginger, rosemary, sage, oregano, and cinnamon can all be used to spice up your meals and turn down the heat. Take care.